Hi, my name's Katie and I am the Fetal Wellbeing Midwife at St Peter's. I'm just here to talk to you today about fetal monitoring in labour and why we do it and how we do it. We monitor your baby's heartbeat more regularly throughout labour, as labour is naturally a more stressful time for your baby. During contractions there's a temporary disruption in the blood flow to the baby, and most babies will cope very well with this. They're designed to cope with it very well and come through labour with no problems at all. However, there are some babies that won't cope as well, and this may be demonstrated in their heartbeat. In labour there are two methods for monitoring your baby's heartbeat. The first is intermittent auscultation, and this is done either through the use of a pinard, which is a trumpet-shaped stethoscope, which we place on the mother's abdomen and listen like this, or with a handheld Doppler, which you may have seen in your antenatal appointments. And again, that's just placed on the abdomen and we listen to the baby's heart rate through that. This method allows you to mobilise freely in labour, and if your pregnancy's been uncomplicated and low risk, then there's no additional benefits in having any more intensive monitoring in labour. Sometimes risks have been identified in pregnancy, either preeclampsia, or you may be having twins, or there may be concerns in labour, for example infection, that mean that we need to monitor your baby's heart rate more continuously in labour. The way that we do that is through something called a CTG, which stands for cardiotocography, which is this machine here. This involves having two of these plastic pads placed on your abdomen, and these record the baby's heart rate and also give us an idea of how frequent your contractions are. And this is recorded as a continuous graph, and it continues for the entirety of the labour. In some cases where it may be tricky to continuously monitor your baby's heart rate through the abdominal pad, we may ask for your consent to place a small clip on the baby's head. This is called a fetal scalp electrode, or FSE, and that would allow us to monitor your baby's heart rate more effectively in labour. All our midwives are trained in using both of these methods for monitoring your baby's heartbeat, and would be very happy to have a discussion about what the safest and best way to monitor your baby in labour is. Thank you.